along with the warmer weather and the beautiful buds that are coming up on our flowers, and trees are beginning to bloom, but along with that, in spring comes allergy season. And for some folks, that's a really tough time of year. Dr. Victoria Uribe, our co-host, has brought us a guest today.
Right, I brought Dr. Jeff Kulik, who is the allergist at the Elmhurst Clinic and takes care of kids and adults. And if you could just tell us a little bit about yourself.
Absolutely. So first and foremost, thank you for having me here today to discuss not only this important but especially prevalent topic this time of year. But my name is Dr. Jeff Kulik. I'm an allergist and immunologist who sees both pediatric allergy and adult allergy out at the Elmhurst Clinic. I've been out at the Elmhurst Clinic for about 9 years now and have done most of my training in the Chicagoland area down at Rush University Medical Center.
Well, before we get into the spring allergies and the sneezing and the coughing and the itchy eyes and throat, I really want to talk a little bit about food allergies, because the spring allergies, fortunately, are only once a year. Even though spring is beautiful, it's tough, but it's only once a year. Food allergies are year-round, and we're seeing more and more children with food allergies. What's with all of this, and how come there are more kids today with food allergies?
Yeah, we're still trying to figure out why the prevalence is increasing, but we do see more and more allergies, food allergies rising in kids. And if we take a look at the most common food allergens, we're talking about milk, egg, wheat, soy, peanuts, tree nuts, fish, and shellfish account for about 90% of food allergies. So those are the big 8 we talk about. But we're still trying to figure out why the rise, why the prevalence here. And just as important as trying to figure out, what the allergen is, we're also trying to figure out what symptoms typically present with. And that's where we work closely with Dr. Uribe, because they're often the first people at the forefront to see kids presenting with these food allergies as well.
And Victoria, as a pediatrician, I'm sure you're seeing a lot of that, but that's pretty scary for new moms and the first time you have a child, and all of a sudden the child has this allergic reaction and you don't know what it is. It's a panic time.
Right. Even from the beginning of life, we're talking about allergies somewhat, because we do encourage breastfeeding always, and that is a protective factor. It does help protect kids from allergies. But we're also the ones who give advice on when to start foods, introduce different foods to hopefully prevent these allergies from happening, and to give advice on what to watch for. Things have changed a lot over the years, though. We used to postpone introducing certain foods until a lot later, and now the recommendations have changed. So, Dr. Kulik, what is the new recommendations now for food introduction?
So Dr. Uribe is exactly right. So, as early as maybe 5 to 7 years ago, the whole principle was avoid these allergenic foods up until the age of 2 or 3. Now the pendulum has kind of shifted to the other side of things, and there's actually studies out now that show actually the early introduction, as early as 11 to 12 months of age, for these allergenic foods like milk and egg and peanut may have a preventive effect. Potentially, with the exception of those people with a family history of food allergies, with either a sibling, a brother or sister, or a parent with a history of food allergies. Then we have to be a little more careful when to introduce these foods.
So a lot of it is genetic, where it's a hereditary thing, possibly.
No, it's a great point. It's 2 points. When we're talking about allergies, we're talking about the genetic predisposition. What genes did you inherit from your parents can make you more prone to having allergies, but also your environment. We're learning with food allergies, there's really 2 ways to be exposed to start developing. One is by eating the food in question, and the other is actually by, believe it or not, the other topic, the environmental allergies, the pollens, can also predispose people developing food allergies to things we wouldn't suspect, like fruits and vegetables, actually.
Really? So an allergy to the pollen can cause an allergy to different type of foods?
Indeed, yeah. We call it food pollen or oral allergy syndrome. The good news is these symptoms are usually milder in nature. It's usually more itchy mouth, itchy tongue, and itchy throat. It usually doesn't progress to like the full-blown anaphylactic reaction we sometimes see with nut allergies or shellfish. But it's usually, believe it or not, like fresh apples, peaches,
really?
Plums,
the
bananas,
good things
avocado.
for you.
Exactly, the things we'd at least expect.
Yeah, I wouldn't expect that. I would expect berries, things with seeds that like strawberries for one, kiwi.
On the list.
That you would expect, but peaches and apples. Apple a day keeps you guys away.
Yeah, we would like to think so.
No, but it doesn't always work that way. But now, Dr. Uribe, you said breastfeeding is encouraged because it helps build an immune system. But what happens if the mom has allergies to begin with? Does that same theory apply?
That's, I think that, like Jeff said, the genetics is part of it, but I think it's separate from the breastfeeding part. I mean, moms are going to avoid certain things if they're allergic already. One interesting study some studies they've done is looking at peanuts and peanut butter, and if moms ate peanut butter while they were breastfeeding, did that protect or not? And it's very mixed results still. So at this point, we're not leaning one way or the other whether they should avoid certain foods or not. So I think moms in general should eat anything that they can eat. Some of those parts that they're eating go through the breast milk, which gives them some exposure, which is probably a good thing. But they shouldn't watch things just because of potential allergies in the future. I think moms need to eat what they need to eat, and they avoid things that they're allergic to, but not being too specific about that.
And sometimes we overwatch.
Right.
You know, you overwatch and you're overly cautious and you're not thinking of building up the child's immune system either.
Right.
Which is sometimes very important.
Right. We're the ones who also, parents, when we tell them to start introducing certain foods, they ask, well, what do I watch for? What kind of symptoms? So we typically tell them, watching for vomiting, sometimes diarrhea, sometimes, for older kids, if they get itching in the throat, or like rashes, like hives all over the body, things like that. So, and just trying to have Benadryl on hand, especially if we're introducing those newer things or potentially allergenic things like nuts and shellfish. Benadryl is the main thing we usually do initially if they get a reaction. But if they do get definitely an allergic reaction, we do see them in the office. And depending on what it is, we'll either do our educating or we do refer on to the allergist, because they have a lot more resources to educate parents of what to watch for. Because it's not just eating that one thing, it's all these manufacturing places that can get some cross-reactivity of allergens. So they're very good at teaching parents how to read labels and how to avoid certain allergens.
Reading the labels and then not mixing foods sometimes.
Right.
You don't realize that. Right. Now, you deal primarily with children.
Right.
But allergies can develop at any age. That surprised me because, in fact, I believe you said you developed an allergy.
Right, a fish allergy as an adult.
As an adult.
I always ate fish and sushi, and now I can't. So.
Yeah, see, and allergies aren't just something that you start off with as a child. You can grow into them, and you can outgrow them.
Great point. Especially on the kid side of things. If you have a milk or egg or wheat allergy or soy, there's about an 80% chance your child will outgrow it as soon as the age of 5. Some a little younger, some a little older, but good chance of outgrowing those allergies. Unfortunately, with the peanuts and tree nuts and the fish and shellfish, if you develop those as a child, they're more than likely going to persist into adulthood. Or as an adult, if you're going to develop a food allergy, it's more likely to be a peanut, tree nut, fish, or shellfish allergen. Those are the predominant ones.
Really, I mean, that surprises me. But yet, it happened to you. I had allergies as a child and outgrew them, and they came back with a vengeance. And then some that I didn't have, I've got now. And I don't know, sometimes the pollen, I never had a problem with that. As I got older, it's bothering me.
Changes, right? And one interesting thing is, as far as deciding if parents or if a child has an allergy or an adult, some of it's based on history, but there's sometimes where parents aren't sure if what they reacted to, so that's when we often send to allergists too. So what are the different types of testing that you do?
Absolutely. So when we're looking for diagnosing a food allergy, Dr. Uribe is exactly right. The history is first and foremost, and we learned in med school about 80% of the diagnosis can be made based upon the history there. So, but with food allergies, we're looking for two types of processes. Usually it's more a cause and effect. Eat the food, and usually within minutes to no longer than an hour or two after ingestion, we expect some type of clinical symptom. The itchy mouth, the itchy throat, the upset stomach, the throwing up, coughing, wheezing, shortness of breath. So some type of closely linked cause and effect process. And that's usually more with the skin testing can actually show us, are they making allergic antibodies called IgE against these foods, which is the cause for these allergies. The other reason we look for food allergies as well, sometimes kids who have allergic skin conditions like eczema or atopic dermatitis as we call it, food allergies can also contribute to more of a persistent low-grade inflammation of the skin that's usually red and itchy and kind of dry and scaly, usually in the creases of the elbows and the knees. So those are the two big diseases we're looking for. Can we find in a food trigger, an allergic food trigger for these kids?
And you mentioned eczema, and sometimes you see eczema at different times of the year. It goes and it comes, and when the weather gets a little warmer, you kind of see it pop out. Is that something that goes with the time of year, or is it just something you have?
Oh, it can, and it could be, believe it or not, it could be related to temperature and humidity or dryness of the year. Dry winter months can make eczema worse if we're not moisturizing on a regular basis. The heat can make it worse if we're hot and sweaty, especially in the creases, can make eczema worse as well, let alone environmental allergens, which we'll talk about too. But the pollen floating around, if it lands on your skin, can also potentially attribute to these itchy red eczema-like rashes.
I didn't think about that, because a lot of times you see older people that develop eczema and they haven't got a clue what it is because they never had it before, but now they're older, they're in the yard, they're doing gardening that they may not have had time to do when they were younger. I never thought about the pollen and the things like that that can cause that problem.
Yeah, lots of triggers, and our goal is to see, can we pinpoint those triggers to we can avoid those things. We talk about how do we treat allergies, and there's really 3 pillars. Know your triggers so you can avoid them if at all you can. Medications to treat symptoms, and then potentially, depending upon the allergy, sometimes allergy shots or immunotherapy, as we call it, can be helpful. So
if it gets very severe,
exactly.
And you're saying treatment for, there's a lot of over-the-counter. And they also should read labels because a lot of them are not good for children under the age of 12. But what about all the over-the-counter allergy treatments? Like the Claritin and...
Sure. Yeah, if we're still talking food allergies, like Dr. Uribe said, great to have some Benadryl around. I think for a multitude of reasons. First time introducing foods, good to have some Benadryl around in case we have a reaction. We also talk about, for food allergies, having EpiPens around, and think of that as a shot of epinephrine or adrenaline. It's the first line treatment for a severe reaction. If you're having problems breathing, swallowing, or talking shortly after eating a food, we're concerned about a more concerning or severe reaction. It's a shot of adrenaline or epinephrine that you can give yourself that starts treating the process as you seek urgent treatment after that. So it's not like a take the shot and then I'm fine. It's take the shot and it buys you time to seek urgent medical attention.
But are EpiPens over the counter, or is that prescription only?
They're prescription. We prescribe them. And the way they market them now, the way that we prescribe them is we prescribe a pack of 2 all the time, because kids are not in one location all the time. So usually there's one for school, one for home, or sometimes each parent might have one with them all the time. But it's good to have, for people who have a history of severe reactions, it's good to have at all times wherever they are, because they don't know when they're going to have a reaction. Schools often have them now too. So for each child who has a food allergy, we fill out a whole form and make sure they have one of those EpiPens at school. But now schools have them available for anybody, because often severe allergic reactions is the first time they've had it, and you don't even have a history of it. So
exactly.
They're trying to have them more available so that if somebody does for some reason have an unexpected reaction, you've got that EpiPen to give the injection, get them to the hospital, and can help save a life.
Because, it's just not the pollens and the food. It also can be an insect bite, right? And EpiPens can be used on insect bites, and spring also brings those little guys out.
Absolutely. That's more likely to be associated like with a bee, a wasp, a yellow jacket, or a hornet. If we're thinking
something that leaves a stinger.
Usually a bee will leave a stinger. So if you see a stinger, it's probably a honeybee that stung you. The yellow jacket and the wasp and the hornets, they won't. But that family, for some reason, is more prone for people to have more severe reactions if they're going to have one.
So and you don't really know that. Like you said, right. Your children leave for school and they're in school, and who knows? And right. The poor teacher who panics just like a parent, and it's even more so because you're not the parent. Mm-hmm. And it's more difficult because you feel more responsible for the 20, 25 children in your classroom. So it's trial and error, in other words.
Yeah, and Dr. Uribe brings up a great point. Believe it or not, about 20 to 25% of first-time food allergies or reactors are actually going to occur in the school setting. So that's why the state legislature passed the law to have undesignated EpiPens for first-time reactors. You know, Billy's got a food allergy, and a known food allergy. He has his EpiPen in school with the school nurse. But if it's Jenny and she's never no history of food allergens, a first-time reactor, the school has something in place where they can actually start treating with their good clinical judgment if this is the first time they've had a reaction.
See, I remember many years ago, one of my children left home just fine, walked 2 blocks to school, got a call from the school. She had swollen. Her throat began to itch and swell, and her eyes were swelling shut. And later on, we found out it's weeds, dandelions, but never happened before. Now you've got a 6-year-old going to school that never had an allergy to all those things growing in your front yard because they're just growing there because they're green. And at the time, there was no such thing as an EpiPen. So fortunately, there was Benadryl and doctors on hand, and you run in and Benadryl works. That is something I think everybody should just kind of keep on hand.
Right.
It doesn't only have to be taken by mouth, correct? It can. I have the like a Benadryl cream.
Right. We usually recommend doing the oral Benadryl though, because that's the much more effective to get in. And Benadryl on the skin, even like for itchy rashes, you don't really know how much you're absorbing. So dosage-wise, because it's based on weight, it's better to do the oral, liquid or pills.
But it's something just to have around. It's not going to. In other words, it wouldn't be detrimental if it was really something the kid didn't need.
Right.
It's not going to be detrimental.
Right.
So it's a good thing just to have in the medicine cabinet and in the car, just in case, because you're out for the day and you don't realize.
Right.
You know. Let's talk a little bit about the watery eyes and the sneezing and the coughing, and is it a cold or is it an allergy? And I'm bringing my kid in, Dr. Uribe.
Right. We get
they have a cold. No, they don't.
Right now it's very difficult because we're still seeing the end of the flu and respiratory illness season.
They're crossing.
Plus allergies are starting. So, and a lot of kids have both things at the same time. But one thing I tell people is just if you have a lot of coughing and runny nose, but it's different colors, it changes colors, that's usually more of an infection, a virus or a sinus infection. But if it's always clear, itchy nose, sneezing, things like that, then it's more likely an allergy. And on exam, we can tell a little bit the difference when we're examining the patient.
But you can't tell.
Right.
Well, because there is a difference. But I mean, they're just crossing paths right now.
Right.
You know, because especially with the wonderful weather that we have in the Chicago area, where it's 84 one day and 44 the next day.
Right.
So it could be just about anything. And I know we've talked about this before. Does that cause a cold? And sometimes it does, and sometimes it doesn't, you know.
And kids also, or adults too, get those same symptoms with pets, with animals. I had somebody recently who had just gotten a new pet and then all of a sudden started having allergy symptoms. So in those situations, we definitely try to do testing, because you don't want to say, yes, you have to get rid of your dog or your cat unless you really know it's an allergic reaction to that.
Yeah, see, that's why they really should visit either a kennel or these shelters. They have the animal shelters that come out to the Petco and PetSmarts. Visit there to see, because sometimes they have an allergy and you've got this pet that they fell in love with, and you know. But it's the dander, correct? Like there are some pets that I forgot which ones they are. I know poodles and schnauzers are dogs that don't have dander.
Yes, very true.
They're considered more hypoallergenic. At some point, every pet's going to express some dander. Just a matter how much dander the pet expresses and how allergic the patient is. So it's a combination of those two factors.
It could even be one of those that doesn't have very much dander and we think has none. But so it depends.
What are the treatments in general that you use, that you recommend for, like, say, seasonal allergies?
Yeah, so we try, it's based upon symptoms. So anything that's red or itchy or watery or sneezy, we talk about using an antihistamine, even something as simple as over-the-counter like your Claritin, Allegra, or Zyrtec. You know, Benadryl would work as well. The potential downside of Benadryl is, though, it only lasts about 4 to 6 hours and probably make you sleepy or tired. But the Allegra, the Claritin, or Zyrtec are more likely to be 24 hours in nature and less likely to cause side effects with it. So on the flip side, if you're more congested and plugged up and can't breathe through your nose, we're more likely to use a nasal spray as first-line treatment, because it does a better job of tackling that congestion and easing your ability to breathe through your nose, which, with these allergies, if they go uncontrolled, not only cause symptoms but can lead to poor quality sleep, difficulty sleeping at night, not getting a restful sleep, and affecting your quality of life.
And that runs down your immune system, because then you get you'll get sick because you're exhausted. So what's good one way is not good another way, and it's like it's trial and error. It's just trial and error, and I think parents have to be a little bit more aware and just do what you have to do. Mm-hmm. Right. And here's one more thing. I was always told if your child is having a serious allergic reaction, if you panic, it becomes harder for them to breathe, so you have to stay calm. Is that correct?
I find that a lot. I think if parents get worked up and nervous, and the kids, if it's hard to breathe, asthma or with allergies, they get a little more anxious and makes it even harder. So I agree, keeping them calm is a good thing.
So the bottom line is to relieve spring allergies. What do we do? Stay inside, turn the air conditioning on, and never go outside.
Easy to say, hard to do, but those are some practical avoidance measures. The more we avoid, the less likely we are to have symptoms. But we've been inside all winter, all year. People are going to go outside and open their windows. But if you keep in mind the pollen counts are highest in the morning, so try and stay in the early morning hours. Try and keep those windows closed in the car and the home, and then take a nightly shower once you're in for the evening, so you're not breathing Mother Nature in with you. And lastly, keep in mind your pets. Even if you're not allergic to your pet, if the dog's going outside and rolling around in the grass, it's another vehicle for bringing
it in. Didn't think about that.
Yeah, so another, so bathing the dog, even if you're not allergic to the dog, can help in other factors, other environmental allergies.
It keeps the pollen outside and not as much on the inside. So limit your outdoor activity at high pollen count times. Close the doors and windows if you do have allergies. Put the air conditioning on, roll up the windows in the car if you have allergies, shower, and wash your clothes because it hangs on to the fabric.
Absolutely. Right. Some simple practical measures to decrease your exposure. And if that's not working, we talk about using medications to try and treat the symptoms.
Or they can call Dr. Uribe. Would you please tell us how they can be in touch with you? And
yeah, at the Elmhurst Clinic, I work in Elmhurst and in Addison at the Addison Center for Health, and our number is 331-221-9002.
And?
Dr. Jeffrey Kulik, I work in downtown Elmhurst in the Schiller Building at 172 Schiller, and our office number is 331-221-9001.
So while we hope they never have to contact you for allergies, just in case, they should have your number. And it was very nice having you. I've learned a lot today. Thank you very much for joining us. And Victoria, it's always good having you here. I always learn more and more. So thank you all for joining us. I'm Lucille Zucchero.
I'm Victoria Uribe.
And I'm Jeffrey Kulik.
And here's To Your Health.